This medication is used to treat certain bone problems, such as Paget's disease and postmenopausal osteoporosis, as well as to reduce high blood levels of calcium. Calcitonin is a man-made hormone that works by slowing bone loss and maintaining normal calcium levels in the blood. It may also help to reduce bone pain in people who have Paget's disease. The recommended dosage and timing for this medication should be discussed with a healthcare professional. Calcitonin, Salmon, 200 unit/ml injection solution is given by injection under the skin or into a muscle as directed by your doctor. For the treatment of high calcium, you will usually use this medication every 12 hours. For the treatment of osteoporosis, you will usually use this medication every other day. For the treatment of Paget's disease, you will usually use this medication daily to every other day. If you are using more than 2 milliliters of the medication at a time, it is recommended that you inject the medication into a muscle. Use this medication exactly as prescribed by your doctor. The dosage is based on your medical condition and response to treatment. It is recommended to use this medication at the lowest effective dosage and for the shortest possible duration to treat your condition. Before injecting each dose, check this product visually for particles or discoloration. If either is present, do not use the liquid. Also, clean the injection site with rubbing alcohol before injecting. It is important to change the location of the injection site each time to avoid problem areas under the skin or in the muscle. Use this medication regularly in order to get the most benefit from it. If you are using this medication on a schedule other than every day, such as every other day, it may help to mark your calendar with a reminder. Tell your doctor if your condition lasts or gets worse. Some common side effects of using calcitonin, Salmon, 200 unit/ml injection solution hypercalcemia agents include nausea, abdominal pain, diarrhea, vomiting, or flushing, as well as swelling/redness at the injection site, a salty taste in the mouth, increased urination, or loss of appetite. If these side effects persist or worsen, it's important to inform your doctor or pharmacist. It's essential to remember that the benefits of this medication outweigh the potential risks, and most people using it do not experience serious side effects. However, it's crucial to contact your doctor immediately if you experience any serious side effects, such as eye pain, swelling ankles/feet, muscle cramps/spasms, or numbness/tingling of the arms/legs. Seek medical help right away if you have any very serious side effects, including seizures. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed above, be sure to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using calcitonin, Salmon, 200 unit/ml injection solution, it's important to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have a low level of calcium in the blood. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, you should only use this medication if it is clearly needed, and it's important to discuss the risks and benefits with your doctor. It is not known if this drug passes into breast milk, so consult your doctor before breastfeeding. Remember to follow your doctor's recommendations and take the medication at the recommended dosage and optimal timing. When taking calcitonin, Salmon, 200 unit/ml injection solution for hypercalcemia, it's important to be aware of potential drug interactions. Certain medications can affect how calcitonin works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with calcitonin is lithium. Be sure to discuss any concerns with your healthcare provider. If you or someone else has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include nausea and vomiting. Remember, it's important not to share this medication with others. In addition to taking this medication, making lifestyle changes can also help promote healthy bones. This includes increasing weight-bearing exercise, quitting smoking, limiting alcohol, and eating well-balanced meals that contain enough calcium and vitamin D. Your doctor may also recommend taking calcium and vitamin D supplements and making other lifestyle changes, so be sure to consult them for specific advice. While using this medication, your doctor may also recommend lab and/or medical tests to monitor your progress. These tests may include urine sediment, bone mineral density, and calcium levels. It's important to keep all your medical and lab appointments, so be sure to consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take your next dose at the usual time. Don't take a double dose to make up for the missed one. It's important to store this medication in the refrigerator, but make sure not to freeze it. Keep it out of reach of children and pets. When it comes to getting rid of any unused or expired medication, it's best to consult your pharmacist or local waste disposal company for proper disposal methods. Don't flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.